Hello, I'm Dr. David Trumbore from Ultimate Physical Therapy, and today we are here to talk about low back pain. So we're going to look at the incidence or how common or how prevalent low back pain is. Then we're going to see the structures in your body from which the pain can come from, and then finally the treatment of low back pain. So I want to start by defining a term that I'm going to talk about, and that word is musculoskeletal. That refers to your tendons, your ligaments, your muscles, your bones, your joints, and your discs. That's to be distinguished from your visceral organs, your stomach, your liver, your kidney, or spleen. The first thing I want to talk about is the incidence of low back pain. The incidence of low back pain is very significant. This is a common problem to have. And the reality is that most of us are going to experience life-altering back pain at some point. As a matter of fact, it's the second leading reason to go to a doctor behind dermatological problems like acne. So let's take a look at the reasons you can have low back pain. The first is muscular. The lumbar spine, your low back, has small muscles and large muscles around it, just like any other joint, and you can sprain and strain them. This can happen from a one-time accident, like a car accident or being tackled or picking up something heavy, or it can be repetitive. There's a nice day in spring, you go out and start working in your garden, you're digging, you're bending over, and you wake up the next day and your muscles are sore. These can be minor problems, moderate or severe, depending on how bad the sprain is. And typically, you'll experience pain right where you strain the muscle. It won't radiate down the legs. And if it's minor, it goes away in a week or so. And if it's significant, it could take 6 to 8 weeks of treatment. If you have pain that lasts longer than a week in your muscles, you should give our office a call for a consultation so we can treat that and strengthen you and limit the chances of you having this happen again in the future. Another source of low back pain is arthritic. You have joints in your lumbar spine just like any other joint, and they can develop arthritis. You tend to develop arthritis as you get older, and it can be accelerated by an injury. And arthritis is simply the joint surfaces, rather than being smooth and gliding on each other properly, they develop nicks and divots and potholes in them and grind, and then the fluid inside the joint that lubricates dries up, complicating things. Arthritis pain typically presents itself by being stiff and achy in the morning, and if you take a shower and move around a little bit, it eases up, but if you do too much activity, then you get sore again. And this is typically located to the low back, and again, it can be mild or moderate severe depending on your arthritis. Very common to have arthritis in the back as you get older, and the great news is this is very responsive to treatment. We know that people who are evaluated and prescribed and participate in the proper exercise program do much better than those who do not. A third source of low back pain can be related to the discs. Your lumbar spine is made up of 5 vertebrae, and they're separated by a disc which acts as a spacer or a shock absorber. If that disc bulges backwards and puts pressure on the spinal cord or the nerve roots, then you get severe pain. This is the kind of thing where someone says, oh, my back went out on me and I couldn't get out of bed for a week. This type of pain is usually debilitating. It's hard to do any activity and it's very severe. You can also have pins and needles or numbness with it if it's bad enough. And in the most severe cases, the disc can rupture and the material can leak out and put pressure on the spinal cord and nerves, causing not only pain and numbness, but weakness in your muscles and reflex changes. And that's usually a red flag that needs to be evaluated because often it requires surgery to remove the disc material. And then finally, there's a fourth cause of low back pain that's common, that's called spinal stenosis. Spinal stenosis is there's canals and tunnels which the spinal cord and the nerves live in, and normally there's plenty of space. So if here's the canal, the nerve root fits in and there's plenty of space. In spinal stenosis, the canal narrows and has very limited space for the nerve, and movement then crimps the nerve and puts pressure on it. That usually produces back pain, buttock pain, pain going down the legs. You tend to feel better at rest when you sit and relax and take pressure off the spinal column, but when you stand up and walk around or active, that compression adds to the symptoms. And the telltale sign of if you have spinal stenosis is if you bend over, which opens up the spaces, you feel better. And if you extend backwards, that tends to produce your symptoms. The good news about these 4 types of low back pain, whether it's muscular, arthritic, disc-related, or spinal stenosis, they're all responsive to physical therapy. Any good treatment always starts with an evaluation. So if you're watching this video, most likely you have had back pain, you have it now, or you at least know someone who does. So I want to encourage you, if you're watching this video and you've had low back pain that's lasted longer than a week, please call our office, schedule a consultation, let us evaluate you, and prescribe a specific program that will help with your low back pain and improve the quality of your life.